Alan can speak in some more detail about this, but the majority of the 22 that are linked to outbreaks are linked to aged care outbreaks. There are 6 that are under investigation. 3 cases have been reclassified, 2 due to duplication, that is historic in its nature, going back to 1 from July, 1 from earlier in September, and 1 due to a false positive that was reclassified after a review. There have been, I'm sad to report, 766 deaths due to this global pandemic, 3 since my last report, 1 female in her 70s, 1 female in her 90s, 1 female in her 100s. All of these deaths are linked to aged care, and we send, of course, our deepest sympathies and condolences to those 3 families. There are now just 83 Victorians in hospital. 8 of those are in intensive care, and 5 of those 8 are on a ventilator. A total of 2,593,744 test results have been received since the beginning of the pandemic. That is 11,123 results since yesterday. If I can just pause on that point for a moment, that for a Sunday, and these will be almost exclusively from Sunday, is a result that is higher than recent weekends that we have seen. So I want to thank each and every one of those 11,123 Victorians who on Sunday went and got tested, just as we've asked them to do. The key point here is, if you've got any symptoms whatsoever, please don't put off going and getting a test. Don't wait an hour, don't wait a day. Please go and get tested as soon as you possibly can. It's a simple thing, but a massive contribution to our fight against this virus. I've made this point a few times, but I want to make it again. Extra positive cases because of a higher testing rate will not hold us back from taking safe and steady next steps. What could hold us back is if we don't have enough people coming forward and getting tested, and we don't think the test results are an accurate picture of how much virus is out there. So no one should feel in any way motivated to do anything other than get tested if you've got even the mildest of symptoms, as soon as those symptoms are known to you, are obvious to you. Please don't put it off a day. Don't put it off at all. Getting tested is such an important thing, and I'm very grateful, very, very grateful that 11,123 people on a pretty good Sunday went and got tested. That is a mighty effort. There are 4,268 cases with an unknown source. That's an increase of 2 since yesterday. There are 74 healthcare workers who are active cases. We send them our best, and we thank them and their colleagues for the amazing work they do. Every facility, every corner of the state, every hour of the day. They are truly impressive people. There are now 20 active cases in regional local government areas that are under the 3rd step restrictions. That is a positive result in terms of the vigilance I think that regional Victoria is maintaining, despite the fact that regional Victoria is much more open than it's been for a long time. Just a week on now, or a bit less than that actually. It'll be by the middle of this week. It'll be a week on since they were able to take not 1 but 2 steps. All my reports, all the advice I've received across regional Victoria is people very grateful to be in those settings, and closer to that COVID normal, but at the same time a real sense of commitment and purpose to stay the course with different rules, but rules nonetheless. There's no vaccine, so until one arrives, there's going to be structures and rules and processes that are designed to keep case numbers low and to keep people safe. And I think regional Victorians are rising to that challenge, and I'm very grateful to each and every one of them. In terms of the rolling average, Metro is 32.8 cases. This is as at the 21st of September. Regional is 1.6 cases. That is absolutely on track for us to be able to take a step on the 28th, on Sunday. You'll all know that the band, the frame that we want to be in, is between 30 and 50 cases for a 14-day rolling average come Sunday. To be at 32.8 now, with obviously several days to go before that trigger point, that is a testament to the hard work and the commitment of every single Victorian who's following the rules. And again, I thank them, and I make it very clear just how proud I am to think that Victorians know and understand, as frustrating, as challenging, as difficult as these circumstances are, this reality, you can't wish it away. You've just got to show the absolute determination and resolve to defeat this second wave, and to defeat it properly, so that we can find a COVID normal as soon as is safe, and then lock that in, not just for a few weeks or a few months, but potentially lock that in for the entirety of 2021, depending on when a vaccine arrives. Just by way of the usual updates in relation to aged care and disability facility settings, firstly, active cases in disability facility settings as at the 21st of September, 4. There are 4 of those active cases. They are all staff. That's always a concern to us. They are very low numbers, but those settings are always a concern to us. I'll come back to aged care in just a moment because it's a good segue to Minister Donnellan and some very important announcements he's going to make. Just on another matter, we've had quite a bit of discussion in recent weeks about just how successful our regional public health teams have been, bringing that local knowledge, a local perspective, being able to respond to what are fundamentally local challenges in a much more effective way. And I'm very grateful, whether it be in Latrobe Valley, whether it be Colac. There's been some very, very good work done there, and I'm grateful to them. The fact that numbers are so low in Geelong, Ballarat, Bendigo, and other parts of regional Victoria is at least in part due to the very good work that those regional public health teams have done. I can confirm that 3 of the 5 proposed suburban public health units, local public health teams, that is in the west, the northeast and the southeast of Melbourne, will be set up in the next few days. Western Health, Austin Health and Monash Health will be the health service leads, working closely with primary care and also community partners to replicate the success that, as I've said, we've seen across regional Victoria. Monash Health, as you know, is already doing amazing work, and the Hallam, that Casey Greater Dandenong cluster that we saw just recently has been expertly managed by a big team, but there's a significant part of that team has been a local response from Monash Health. And to all the team at Monash Health, I want to say thank you very much. You've done an amazing job. The Western Health has also been doing some contact tracing for a little while now, and some prevention work within their local communities. They've been working very closely with primary care providers across the west of Melbourne. From next week, both of these services will begin to stand up local public health units. We'll report progress as that occurs. As well as that, the northeast public health unit will be led by Austin Health, and that will follow. That'll be more next week than toward the end of this week. But we'll provide you with updates as we go. It's important to set these teams up, do it properly. As I've said on many occasions, this really does come into its own when you're trying to keep numbers low, and when you're trying, with the inevitable positive cases, the inevitable outbreaks that we will see as a result of the wildly infectious nature of this virus, that localised response, that even faster response, because of the input of local knowledge, will really come into its own when we are trying to keep already low numbers even lower, or at least to maintain them, so that we can maintain that COVID normal. As I said, I'll report progress as we go with the establishment of those. Just finally, before I throw to Luke, active cases in aged care, 328 active cases. In terms of aged care shifts, and again, because you can't really ever say it enough, to our hospital staff, and it's a big team, it's nurses, but it's also personal care workers and others, 4,680 shifts from hospital staff that have gone into private aged care. Very few of them would ever have thought that they'd be working in private aged care, but given the very challenging circumstances within that sector, and within many homes within that sector, they have risen to that challenge and done an amazing job. Very confronting at times, very, very confronting. And I just want to, on behalf of all Victorians, and if I might, on behalf of family and loved ones of residents, I want to thank all of those staff, those hospital staff, who have gone in and I think done an amazing job. Now, speaking of aged care, as you know, the Victorian Government has the largest public sector aged care profile of any state or territory anywhere in the country. We did not sell off these assets. Others have made their own choices, but we have a very significant presence in the market. We're one of the biggest players when you add up all the different public sector aged care homes that we have. They are not just in Metropolitan Melbourne, but many of them are in regional Victoria. And it's fair to say that there perhaps wouldn't be aged care in some of these smaller regional communities if it weren't for the public aged care that is there, the not-for-profit aged care, owned by every Victorian and there to support every single Victorian. Nurse to patient ratios operate there. There are a whole range of different things that we do, and we're proud of that, and we're proud of our staff. And we've invested very heavily over these last 6 years to make that sector even stronger. Some investments quite small, but big impact, others of a much larger nature. Today we add to that with a further $30 million to provide upgrades large and small. That's all about creating jobs at a time when they're needed, and all about making sure that every resident in public sector aged care gets the very best care that they and their family are entitled to. I'll now ask Luke to speak to the details of that package. Alan is here as well to speak to the epidemiology of the day if you have any questions for him. And of course we're happy to take all of your questions at that point.
Thank you, Premier. I guess it's very appropriate this week. It's Dementia Action Week. So it's very appropriate to be talking about our aged care facilities. As you'd be aware, Victoria has approximately 10% of the aged care market in Victoria. As the Premier was saying, in regional and country Victoria, they'd be very lucky to have aged care provision. If it wasn't for the state, 80% of aged care provision in country and regional Victoria is very much provided by the state. So today we're announcing a $30 million package to upgrade facilities across Victoria, whether it be from Richmond to Rappunyup. So 33 facilities in regional Victoria, 17 in metropolitan Victoria. These are things like, for argument's sake, as I was talking a minute ago about Dementia Week, gardens, to upgrade gardens to make them dementia friendly, upgrades of kitchens, common areas, floors and alike. A lot of it is maintenance based. It's been identified in 2019, some of these works, so now we're getting on with doing them. As we know, in terms of our aged care facilities, I think in terms of state, there's been a cumulative total of 15 COVID positive cases in our aged care facilities since January. So it just highlights the importance, as the Premier was saying, of the nurse to patient ratios, 1 to 7 during the day, 1 to 8 in the afternoon and 1 to 15 in the evening. And that provides that clinical capacity within the aged care sector. There's also the links to the hospital system as well, which provides greater capacity in that space. And that's obviously, presently we're also doing that work with VARC in terms of linking our aged care facilities into private providers. But at a state level, this is an ongoing thing we have every day of the week, that we have links between our aged care facilities and our hospitals to ensure the very best of care, the best clinical governance, and more than anything else, that preventative care. And as the Premier was saying a couple of minutes ago, Monash Health, which I spent a lot of the weekend working with in relation to City of Casey and so forth, but Monash Health has been out there in terms of providing guidance and assistance in terms of infection prevention across the whole of the sector. I think to date there's about 3,000 people waiting presently for some training, but about 2,000 people have been trained and about 200 trainers have been trained to ensure that we have that, I guess, that ring of confidence around all our aged care providers, but especially today, I guess, more than anything else, just providing confidence to the community. But in terms of our public sector, we know it's the very best care we can possibly provide, and that's because 80% of our staff in the public sector aged care facilities are nurses. It is very different from other parts of the sector, and that's why we have that strength in preventing infection coming into those facilities, because we've got practices, we've got quality staff in those facilities. So very good news in terms of this week, in terms of since it's Dementia Action Week, that there will be major upgrades for various facilities across the state to provide that highest quality of care that our public sector aged care facilities provide. Thank you.
Very good. We are happy to take any questions you have.
Minister Janellen just said that this work was identified in 2019. Has it only been prompted to get done by the COVID pandemic?
No. We do annual audits of different facilities. There's a bidding process, if you like, a process where different facilities can bid up for maintenance grants. We have, for instance, some of this package is funded out of the Regional Health Infrastructure Fund, the RIF fund that we've added to each and every year. So that goes through a grant round process. They're granted, approved in 1 year, and the work commences in another. I'm not sure whether some of these works might be happening a little later in 2020 because of various COVID restrictions, but it's really important that we get on and get it done. And there'll be a grant round this year, and we'll stand up at some point in 2021 and announce that.
Is there money to assist infection control in some of these facilities?
Well, this is all capital money, so obviously in terms of recurrent budgets and support for additional PPE, training and the like, all of that is funded separately.
Premier, Denham Hitchcock from Channel 7. I don't think anyone would doubt that you're doing what you believe is best for the people of this state, and you're in front of this press conference every day, which is impressive. But please don't tell me that it would be pride that would be stopping you from revising the dates to get this state back on its feet.
Well, I'm not looking to impress people. I'm looking to get the job done. And this is not a matter of pride, it's a matter of science. And the data, the evidence, the science and the doctors tell us, and I think, to be honest, common sense tells you, that unless you get the numbers low, you can't hope to keep the numbers low. It's frustrating, it's very challenging, but this does take some time because the nature of this virus is there is that latency, there's that lag, where what I do today, or what the team advises me to do today or tomorrow, the impacts of that will not be clear to us for 2 to 3 weeks.
Premier, no one is with you on this, the federal government, not the states, not the university that has done the modelling for you. You've got people quitting your own government over it. I mean, it's got to be pretty lonely at the top.
I barely have time to run through all the different errors that you've made in the list that you've just put forward to me. I don't agree with that assessment. I don't think Victorians agree with that assessment. Victorians know and understand that we have to see this thing off.
Tony Blakely did the modelling for you, sir. He this morning has said that the date should come forward.
Well, there are many different views in any scientific discussion. We're grateful for Mr. Blakely's work. He remains someone who is advising the government, but today's not the day to be announcing what will be occurring in October, because we have many days to go where we need to drive these case numbers down. In terms of the federal government, our partnership is a strong one. It's very important that we're not, any of us, playing politics with these things. It's all about making sure that we defeat this virus, and popularity or pride or politics is not a vaccine against this virus. Only getting the job done with an absolute determination to make sure that everything that every Victorian has given, everything that every Victorian has done, must count for something. And if we don't do this properly, if we open too much too soon, as many other experts today have spoken about, then we will be pinballing in and out of restrictions all through 2021. I don't want that. We're going to do everything we can to avoid that.
Premier, is it good enough for your top advisor, Chris Eccles, to not know who made the decision for private security to be engaged, and also for him not to pass on the email to you from Phil Gaetjens offering the ADF?
Well, as I've consistently said, Simon, there's a process going on at the moment, and it's important that that process runs to its logical conclusion, and that will be findings, guidance, all sorts of material that will come out of that. They'll make recommendations, I would think, about what next steps should be, and I'll leave it to the inquiry, which I'm assisting later this week, to do that important work.
Will you answer those questions tomorrow if asked?
Well, what I'm asked is a matter for counsel assisting. I can confirm to you that I'll be truthful, absolutely honest and direct.
Obviously you're not answering the question in this forum. Well,
this is not the forum to do it, Simon, with the greatest of respect. I understand why you asked the question, but there's a process going on, and I'll be part of that process. And it is not appropriate for me to be essentially duplicating that process from this podium.
There has been a lot of criticism that a lot of top bureaucrats seem to have I don't recall response. Do you think that it is okay for people like Chris Eccles to not really say that they remember what happened in decisions, for example, hiring thousands of people worth millions of dollars and how that happened? Do you have confidence in the fact that no one is being held accountable for these decisions?
Well, again, the inquiry has not concluded its work, and the answers that we need, the answers that we don't have, is exactly why the inquiry was set up. Not for the avoidance of those answers, but to get them. And of course, the fullest and most detailed way in which we'll get those answers is when the inquiry has concluded its work.
Do you expect that at the conclusion of the inquiry, Victorians will actually know who was responsible for those crucial decisions? Because so far in the inquiry, we've just heard a lot of people saying it wasn't me.
Well, my only expectation, Rachel, is that the inquiry will do its work without fear or favour. And as to what's in their report, what findings they make, That's entirely a matter for them, and the final report is still some way off, but I'm very confident that they are thoroughly examining all the issues that they believe are relevant and which were set out in the terms of reference.
Are you going to, sorry, I understand that there might be delays in the witness list. Are you definitely appearing before the inquiry tomorrow?
That's entirely a matter for the inquiry. It's not for me to make announcements about their schedule. Have you been
notified of a different date?
Yes, but it's not for me to make announcements. I will be appearing as the board pleases, and that's a matter for the board.
May not be this week. It may be.
As I said, Alex, it's not for me. I'm not a spokesman for Her Honour, Judge Coate, and the Board of Inquiry. That's a matter for them.
Do you know if the inquiry is extending its time to allow more time for you and your ministers to be quizzed?
I'm not quite sure what the question is.
Has
The overall
Jennifer Coate asked
timeline.
you- Has Jennifer Coate asked you for another extension of time?
No.
Okay.
Premier, if the inquiry doesn't determine who decided to hire private security, has it done its job?
Well, again, you're asking me to predict or to forecast. That's an entirely hypothetical matter.
I'm not asking you to predict or forecast.
Well, you
I'm
are.
asking
You're putting to me something that hasn't happened, and you're asking me to comment on what
Well, you
might be
expected
my
the
response if it
inquiry
did happen.
finds
That
out.
is the definition, any fair-minded definition of what a hypothetical is. And again, I'm not criticising you for asking the question. I'm simply saying to you that it is a hypothetical matter, and all of those matters can be settled one way or the other when the final report is handed up, and then we can have a discussion then.
Can I expect your
How
memory
how important is accountability in your view? Because the public feels that there is none.
Well, having established an inquiry to get answers that are necessary, I think my views on that are very well known.
Yeah, but if the inquiry is not delivering answers,
Well, you're drawing a conclusion there that I don't think is necessarily a fair one, but even leave that debate to one side. The inquiry's not finished, so trying to predict or to hypothesise or opine about what will be there at the end of that process, I don't think is a helpful exercise and not one based in fact. It is speculation and nothing more than
there'd be
that.
a lot of memory loss though, doesn't there?
Well, you're free to draw whatever conclusions you want to, but please don't expect me to provide. Well, we will.
Pretty basic questions.
As I've said to you, Alex, the process is not finished. When the process is finished, we'll be able to speak not about what might happen, but what indeed has happened. And that, I think, is a much more productive discussion. That'll be a conversation based in fact and finding, rather than the obvious speculation that you're inviting me. And again, you're entitled to do that. And I'm also equally entitled to say to you that that's not something I'm going to get into.
Premier, will your memory be as vague tomorrow as your bureaucrats seem to have been?
Well, you can make judgments about the memories of others. When I appear before the inquiry, I'll answer questions as honestly, frankly, clearly, directly as possible.
Can I ask
Still
Alex?
stand by your statement that the ADF never made a support to Victoria?
Well, that's not exactly the statement that I've made, but I can confirm for you that the statements I have made, I stand by.
Can you just clarify those again for us on the record?
No, I will not be doing that, as I've made very clear to you.
Not even considering that you're about to discuss this, just to refresh everyone's memory before
Well,
we go ahead.
no, Alex, because in the bit where you just stopped in your question, you've kind of answered your question, given that you're about to. That's the key point. I'm about to speak to the inquiry.
The record, so let's
Well, it's already on the
refresh
record, and
everyone. Get it.
I have sufficient confidence in your research skills. You'll be able to go and look. Listen, you and I both know what I've said, and you know what my answer to the question is. And I'm not going to speculate on what I might or might not say.
I'm just
well,
trying
I think
to
you
really
might
just
be.
clarify your position once and for
And
all before we go ahead.
well, everyone gets a go. You can all try and have a go at once if you like. That's not the way this normally works. I am not going to speculate about what I'll be asked or the answers I'll provide later in the week. That's the first point. On the second point, my public comments are on the record and I stand by them, and I am not going to run through them from A to Z today. I'm not doing that.
In one of those comments, you told the Parliamentary Accounts Committee that it was fundamentally incorrect to assert that ADF was on offer. So, do you now know, given the evidence that has come before the inquiry, that to be an incorrect statement?
No, I'm not making that judgment at all. As I've said to you, I've made comments on these matters.
What allows you to make that judgment?
Well,
that it's
I've
not
made
incorrect?
comments on the matters, and I stand by the comments I've made. And again, I'm not interested in adding to those comments.
And what
Those
do you
comments
base those
directly
comments on?
contradict some of the evidence we've heard, though. How can
Well, in
how does
your
that make
view,
sense?
Rachel, they may do that, but
No.
it's not for. Can I say to you, it's not for any of us here to be pretending to do the work that the inquiry's doing. It's getting on with its job. Let's let it do that, And then at the end of that process, we'll be in a position where we can look at the findings that they make, the recommendations they hand down, and have a much more expansive discussion.
Will you
What are you
accept all
basing your
recommendations of the
comments
inquiry, Premier?
Yes, I believe we will. That is our standard practice. We don't set it up for any other reason than to get answers. And I think that without speculating too much, there will be findings, and then there may be a process to recommend things. We would look at those recommendations very carefully, and will be and are grateful to the Board of Inquiry for the work that they're doing.
Just
Given
to
we have a long
Alan,
way to go in this pandemic, given we have a long way to go in this pandemic,
Sure.
and there's a lot of really critical decisions getting made on a daily basis still at this time. Have you made recommendations to the public service and to the people making these decisions, I guess, to do better when it comes to record keeping, so we don't have this kind of palaver again?
I don't know that I have specifically drawn those matters to people's attention, but they are clear that, as I am, mistakes have been made with this program. They're not acceptable to me. I don't think anybody in any senior position, whether it be in the executive or in the public service, are in any doubt about my views on these matters. These mistakes are unacceptable. The fact that we can't answer some of these questions, and couldn't at the time when it became apparent that there had been outbreaks and the virus had got out, that is exactly why an inquiry was set up. If those answers had been available at the time, then perhaps we would have been able to take action at that time, different steps. But we didn't have those answers, and that's why the inquiry has been set up. But be in no doubt, because I don't believe anyone in any position of authority is in any doubt, that those mistakes are unacceptable to me and unacceptable to the Victorian community.
Are you
Let's ask
confident
Alan
that there
about
are
some numbers.
chains of command in the public service at the moment where it's actually clear who's responsible for what, who's reporting to whom? Because that seems to be something that's been highlighted so far.
Well, there's certainly been evidence led to that effect. The findings, though, that's not a matter for me to be a commentator on that or to preempt whatever findings Judge Coate might make.
But getting away from that in terms of the approach to
I'm
managing
confident
the
in the
pandemic
arrangement.
at
Well,
the
look,
moment,
yeah.
are you confident?
Yes, I am.
Yeah.
And if I took you to the reset of the hotel quarantine program, then I think that is a case in point.
Will
Just
you
to
wait
Alan
until
on
the
the-
findings of the inquiry before you reopen the hotel quarantine program and let Victoria take international arrivals again?
Yeah, this is challenging in that obviously the inquiry needs until early November to hand down its report, but I think it would be unwise for us to make final judgments about what the replacement looks like without having the benefit of the inquiry's report. Having said that, though, there is a lot of work going on now even to be ready for the day in which we're able to have those flights land again. So it's a bit of a balance, Laurel, and I think that we can strike that. And even if I might say that might mean that flights return a little later than they otherwise would have, but given what's at stake, I think that's the right call.
Would it be fair to say the new program would be profoundly different to the
Sorry?
original? Would it be fair to say the new program would be profoundly different to the original?
Well, it is a very different program right now in the fact that it's been reset and Corrections Victoria run it. So that is different to what was there. As for the final design, I think it's a bit tricky to answer your question definitively. We need to wait for the thing that we don't have yet, which is the report, whatever it might say. But there's some work going on at the moment to be ready to make sure that we can have flights on the ground as soon as is safe.
Let's ask Alan about some numbers.
Certainly
today,
you
if that's all right. Come forward. Alan, how's the case cluster tracking?
Actually-
Is there any new cases there?
No. So actually, there haven't been cases in that cluster for 2 days, which is very reassuring. There are still close contacts being monitored among those households. So it's obviously possible and probably likely that some of those may become positive. But obviously, the important point is that we have them under support and making sure that they're not going to transmit on to other people except within, hopefully, only within their households.
Do Do you know how many tests have been done down there?
Yep, so there have been 201 tests done at the pop-up sites and 806 tests done at the Monash community sites. So that's pretty encouraging, and it's really we're really thankful for people coming out to get tested. I think just to go to a point that was made, so we have had 28 cases today, and I think that does reinforce that we're looking at a long-term trend, over 14 days rather than one-off days. So obviously it's a bit disappointing on one level that this is much larger than yesterday, but on the other hand, these are 28 cases we didn't know about before, and it's important that we keep a lid on the infections. 22 of those cases from reported yesterday were in known outbreaks, so we had contact with them before this time, and then the 6 others are under investigation at the moment. I would also point out that we do have 620 active cases, so this is 620 people who are potentially infectious and can transmit the infection on, and we have 1,173 close contacts. So again, some of those people will become positive, and that's really why we're looking for a relatively low number before we exit, rather than just sort of single one-off reports of the day. So again, the average over the last 14 days in Metropolitan Melbourne is 32.8. So we obviously it's tracking down nicely, but we do need that to be lower so that there are less infectious people out there and less close contacts.
620 active across Metro Melbourne or the state?
That's across the whole state.
Professor Chang, just confirming there's no new cases in regional Victoria today?
So as of reported today, yes, so yesterday.
Yeah,
yep.
And so there's 20 current active cases in regional Victoria, which by your timeline, when would you be expecting, with no new cases in regional Victoria, that to go down to 0?
So, I mean, they reflect what's happened mainly 14 days ago, and I guess probably over the next week we would expect that to drop even further.
So in that case, where's the sense in making regional Victoria wait until the entire state has had no new cases, which is currently tracked to November 23, before it's allowed to then move to the next step?
Yeah, so of those, so I haven't got the exact figure, but of those, 1,173 close contacts, some of those are in regional Victoria, and there is always the possibility that people move across from Metropolitan Melbourne to regional Victoria for all sorts of legitimate reasons, working and so on. So it is a cautious approach to make sure that we don't cede regional Victoria. And just as an example, Colac, and this is going back a number of weeks ago now, one case resulted in more than 30 secondary cases at that time, even under those settings. So it's very important that we make sure that we have a very quick response to anything that happens out there, but there is always the potential that regional Victoria will be ceded, and that's it's important to just keep that in mind.
Do you know that the 22 linked to known outbreaks, the Premier said the vast majority were in aged care? Do you have an exact figure on that?
Yeah, I understand it's 19, but I think there's a couple of cases that might still just be trying to be sorted out, but that's my understanding.
And are they staff or residents, do we know?
So they're linked to, so it means that some are residents, some are staff, and actually some might be household members of staff members, for example. I can't give you that breakdown.
Mr. Cheng, I understand you're meeting with gym owners or members of the health industry sometime soon. Is that correct? And if so, what do you hope to gain out of that meeting? And could you be persuaded to offer some different health advice around the opening of gyms in a COVID-safe way? Look,
we're always meeting with all industries, and DJPR are working on that. We are meeting with representatives from the gym industry. I would point out that gyms are relatively high risk, so there have been lots of outbreaks across the world. In Victoria, even despite gyms being closed, obviously recently we had an outbreak that had 27 cases linked to it. And in New South Wales, even with their relatively low numbers of community cases, the gyms have featured fairly prominently in their outbreaks. So it is unfortunately a relatively high risk setting. That said, there are things that can be done. So particularly outdoor settings are things that is much safer. There, for example, there's a plan for boot camps and things that can be done outside in a much more safe environment to be done. But
Alan, the cluster you were referencing there, the one with 27, I understand that occurred in Hallam in in July or June.
Yep.
Do you have more detail on that? We haven't really heard about that until the last couple of days. Why haven't we heard about that any earlier, and what can you tell us about that cluster?
Yeah,
Did it start? Do you know if it started or was sourced at the gym?
So I don't have the full details on that. I do understand that there were 27 cases linked to that gym. There have been 700 something outbreaks, so I don't know the details of each of them. But
You don't know the source?
we know that there was a first case, and we know that there were 27 cases linked to that.
But you
but
don't
I
know
don't know.
whether, like, a person's brought the virus to that gym. Like, you don't know yet how it's spread.
No, I don't.
In terms of mystery cases, can you just give an update on what we're seeing in that?
So they've been going down. 4,268 with 2 added yesterday. I probably can't give you much more detail than that at this
Based on
stage.
those figures in the roadmap, are you because we've always said less than 5 active cases, and mystery cases has been no mystery cases. Are we on track in terms of the mystery cases and the growth there?
Yeah, look, I think we are at this stage. We're really obviously doing a lot of work to try and chase those, the source of those mystery cases, and I think those numbers are relatively low. But just a reminder that every mystery case is at least one other case out there that we don't know about, and it's really important that we do our best to try and track where these cases come from.
Given the role those mysteries cases play in the roadmap, would you be able to start giving us a breakdown of where they are, like the LGAs that they're linked to? And also, there are 6, I think yesterday there were 6 cases in the day's numbers that you're yet to link to outbreaks. Would you be able to start giving us LGAs for those like other states do?
Yeah, so I think it's important. So I guess mystery cases and cases under investigation are slightly different. And the ones that are under investigation are under investigation. So as an example, there was the case I think it was in reference to Shepparton. Then after investigation, we found out they're actually in another state. So they are under investigation, and it does take a bit of time. Probably just one insight into the data. The data is taken at midnight, and often by the time we stand up here, they've actually been spoken to. But we have to analyse the data at a particular point in time, and we can't keep updating it. So by the end of the day, we often know more about these cases than what we have at midnight, for example.
If that's the case, perhaps you could tell us more about them the next day, maybe?
Yeah, we'll see what we can get you. Yeah.
Because other states seem to be able to provide that info, and as our numbers come down, it'd be good to have it.
Yeah, we're clearly keeping a very close eye on the last cases that are out there.
There's a push by some councils, because we know that cases are concentrated in certain spots. A number of local government areas in Metropolitan Melbourne are saying, we've got really low case numbers here. Why can't we open up? What's the argument behind keeping them?
I think our experience in I think in June or July probably speaks to this. So we, there were lockdowns of particular postcodes, but we very quickly learned that things can happen. People, particularly in Melbourne, move between areas, and the postcode or the LGA that we have is their area of residence. So people move legitimately for work and for other reasons. So it is very difficult to do a postcode or an LGA lockdown, and I think. And there are still cases in, small numbers of cases, but in quite a large number of LGAs at the moment. So it would be nice just to have those numbers all low, and then we can all move together safely.
Premier, the hotel quarantining.
Simon, before we
Yeah, sure.
can I ask Professor Tim a question? Just on the test series towards the end of the year, the India and Australia. The first test is due to be held in Adelaide, the second on Boxing Day in Melbourne. Do you anticipate for players and staff to quarantine in Melbourne?
Oh, look, that's a little way. This is about the cricket. I didn't quite catch your question, but yeah. I think it's a little way off. I think we need to see what the settings are at that point in time before we get to that. And we've got a fair bit of time to make that decision.
Premier.
Just on the 28 cases, are they all from yesterday?
They were all reported yesterday. Or notified to us yesterday.
And just on the high risk notifications, I know some epidemiologists have sort of been a little bit critical that they're quite vague. I think there's one for the train between Ballarat and Melbourne. There are about 30 trains a day between Ballarat and Melbourne. Is there a possibility, there are some that list entire shopping centres over entire, a series of days. Is it possible to make those a little bit more specific in terms of, times and particular shops?
Yeah, we're certainly looking into that to see if we can get a bit more specificity over some of those locations, both in space and time. Yep.
Premier, the hotel quarantine inquiry has just emailed journalists confirming that you'll be appearing at 2:15 p.m. on Friday. Do you know why that? Just to go back to our questioning before, do you know why it was moved? Was it because
it's entirely a matter for the board. That they've made a decision. They're running a schedule. They're hearing from witnesses. They'll make their arrangements.
So you didn't have any input on the time
No,
at which you're
I
appearing?
did not.
The children's
Just to be
dance-
clear, none whatsoever. The board decides who gets called and for how long and on what day and at what time. That's not a matter for me.
Premier, in regards to the roadmap, why is it that your contact tracing teams can't handle more than the 5 cases? Why is that number so low?
Well, I don't accept your conclusion. That's not what the roadmap says at all. It is, however, I think a statement of logic that unless you get numbers low, you have very little chance to keep them low. That's the experience in other states. It's the experience, sadly, the other end of that in so many countries around the world. While we're reporting our last 4 days, 21, 14, 11, 28, that's less than 20. That's our 4-day average. So Victorians can be optimistic that this strategy is working. We're chasing an average of 30. We've still got the rest of the week to go, and we're almost at that now. All things being equal, we're going to meet that target, and we're going to be able to take some steps, albeit cautious steps, on Sunday. As for how October unfolds, we'll have more to say about that as more data comes in, as more of the well-founded assumptions are replaced by actual data, things that have actually happened, case numbers as well as the narrative that sits behind it. Our contact tracing meets all benchmarks and indeed exceeds some of them in the national dashboard. There was a report provided to National Cabinet last Friday that has actually resulted in a situation where other states will be implementing many of the changes that we have made. So I don't accept the conclusion you've drawn.
So is there a chance that October figure of 5 might actually increase, especially given that New South Wales has been operating sometimes in the 20s and 30s with contact tracing teams and relatively open?
That's why it's very important to acknowledge that New South Wales and Victoria, from an epidemiological point of view, are in vastly different places. New South Wales has not had the amount of community transmission that Victoria has. New South Wales has not had anywhere near the extent of that interplay between large households and high-risk workplaces. And there are some other features. The virus has presented differently here. Some of the community seeding, some of the chains of transmission are very different in Victoria, certainly in Metro Melbourne, very different than what's occurred in Sydney. That's not for a moment making the point that Sydney's job's been easy. They're doing a good job. We're doing a good job. We're doing the best we possibly can to drive these numbers down, because that's the only way you'll keep them low, is to get them low. But we've always said that data trumps any assumption. The actuals always beat the assumptions, and that's why modelling gets rerun. That's why there's a constantly evolving picture where we add in what's actually occurred to replace some of the well-founded, but it's always speculative, because they are by their nature. They're not facts. They are our best estimate of what will occur, and there's more than 1,000 of them gone into this model. Some of those are absolutely replaced by the actuals now more than 2 weeks after the announcements.
Premier, the children's dance school industry wants to know why it can't open up in line with other schools, given that kids can have dance classes in schools.
That's a matter for health advice, but I'm more than happy to follow it up. I'm familiar with that issue. And I'm more than happy to chase that up with the public health team.
And just for regional Victoria, 2 Ballarat train services from Southern Cross have been identified as high risk locations. What measures are we putting in place to protect public transport and make sure that people are protected there?
Sure. So there's a rigorous process of cleaning, and I think passengers both on the Metropolitan network and the regional network would have seen that. There's a lot of effort going in to try and deep clean essentially each of those train carriages as often as possible and all the high touch points, and I thank all the staff that are doing that. In terms of getting information out to people, I just encourage people, if you believe that you may have been a passenger on that train or you're a close contact of one of those people, please go and get tested. There are a number of sites in that Ballarat community, and indeed, if you couldn't get to a test site but you had symptoms and wanted to be tested, we can come to you. And we've done that with many thousands of people now. So getting tested if there's any symptoms at all, that's the really important point.
And just on elective surgeries that have recommenced in regional Victoria, what lengths is the government going to ensure they can get on top of the backlog there?
Sure. So the first thing, this is just a graduated number of steps that have to be safe. And so we've, regional Victoria is a little bit ahead of Melbourne, but we've resumed elective surgery in the back end of Category 2 and Category 3 in hospitals across the whole state. This is also a private hospital system also. We'll have more to say quite soon about a very substantial blitz to make sure that we can catch up on those people who, for the best of reasons, I know it's very difficult, it's very inconvenient and painful, and it's not an easy decision, but many people have not been able to get their surgery. There is a backlog, and we'll have a dedicated fund to move through that so that people can get the care they need as fast as possible, as safe as possible. That's the really important point here.
Premier, there's still a bit of confusion and uncertainty among businesses about exactly who can and cannot open on Sunday or Monday. Is there any more information forthcoming? Is the government planning on tweaking things? A more detailed document coming?
I don't want to be coy in any way. Sunday is some days off, and we can't be that isn't settled. That's a matter that'll be informed by the data I've just reported, plus tomorrow's numbers, so on and so forth. We'll have accompanying all of that on every single conceivable platform. We'll have as much information out there as possible. If there's any specific questions that you want us to chase up, I'm more than happy to do that. I don't have the roadmap in front of me, so I wouldn't quote from memory, but we could always chase up any specific issues.
So some of these businesses are only going to get, say, 24 hours notice about what...
No, we're in deep conversations, for instance, with the supermarkets, deep conversations and ongoing conversations with the meat processing industries. Some of those restrictions are not necessarily apparent to customers or to the general public, so they're not operating at 100. They're nowhere near 100%. Some of them are down at 66%. We're in deep conversation with all of them, and there are different options. And I suppose what we've spoken to them and tried to share with them is a sense of we'll have to pick one of these options, and they know and understand and can plan accordingly for what each of those options would mean. But which one we choose in each of those sectors will be a product of numbers as they present throughout the week, but also the narrative that sits behind those numbers. Is it a contained case? Is it a mystery case? How many cases are there? All of those things. If I could call Sunday right now, I would, but I can't. I've got to wait and see what the data tells us over the rest of the week. But Victorians can be very confident this strategy is working, these numbers are coming down, and I think we are ahead of where we thought we would be, and that's a testament to the hard work that Victorians are putting in.
Where is all the businesses though who don't know if they're going to qualify to be able to open next week? You know, sole traders and people running small businesses.
Yeah, we understand. We understand that notice is very important. And if we were going to make a change in any area, we would always try and provide as much notice as possible. But again, I'm not a spokesperson for those sectors. But my sense of it, from lots of discussions and lots of feedback, is that if people got the green light to open, they would be pleased about that. And even if they got that notice on one day and it was effective the midnight the next day, I think they would be pleased about that. That these are unprecedented circumstances, and the notion of providing people with weeks and weeks of notice during which they would remain closed, that's not really that. You wouldn't want to do that. The other thing here is that we've just got to use because you've got to be careful and safe and steady. You've got to use all the data that you get. So I think there was a bit of a discussion about when these decisions will be made earlier in the week or over the weekend actually, and it'll be a very busy weekend to make sure that what we do on Sunday is based on the most current, the most contemporary, the most accurate picture of what the virus is doing at that time. Not Sunday morning as such, but it'll be a very long Saturday and a very late Saturday night, I would think.
Do you know if the sole traders package, if the applications are fixed and open yet? Apparently some sole traders have been reporting to us that they're still not able to apply.
I understand that specific program opens later on this week. I'll get you an exact date. In terms of the Business Support Fund, that opened last Friday. And my advice this morning, just at a quick update, was that there's more than 20,000 applications have been received, and provided the information on the application is accurate, we turn those around within 5 business days.
So why the delay on the sole traders package?
I'm not certain. I think it'll be...
Do you think it's tech? They're just trying to get the tech or the
No, I don't think so. But look, rather than me speculating about it, let me try and find out. But certainly, the
I guess my broader point is why is there a delay when it was announced more than a week ago?
Well, let me find that out for you. I don't have the answer to that. But what I can assure people is once those grants are open, just with the Business Support Fund grants, they'll be paid out as quickly as possible.
And they'll the government will take into account all this time that they've been waiting to apply. I imagine to while you're waiting to get the system online.
I'm not sure that that's. I'm not sure that that's the issue. But what I'll do is I'll find out for you.
Premier, under the current roadmap, regional Victoria can't progress to the next step out until Metro and the rest of the state sorts out what's going on.
Yes.
Is there a chance that it will change and it will have its own individual roadmap again for the next step?
Well, I couldn't rule that out because it will be based on evidence and data. But the point I'd make to you is that getting the whole state to one unified position is obviously very important because there is movement. As Alan made the point, there are close contacts of cases in Melbourne that live in regional Victoria. There are other close contacts of people. There are active cases. And of course, we know that not everyone who's symptomatic gets tested, so there will be more cases out there than we think. That's just the nature of this virus. Getting everybody on an equal footing is important, but at the same time, I think what we've shown in regional Victoria is taking 2 steps and being at step 3, which is a different position to Metropolitan Melbourne, we are prepared to have the rules in regional Victoria reflect the way the virus is actually presenting in regional Victoria. I'm not making announcements today about that, but we'll always be guided by the data, and we'll always be guided by the science of it and what's actually coming through and what we think is safe. So we've got regional Victoria in a different place now, and that's a testament to how hard regional Victorians have worked. But to be honest, I cannot today confirm for you the announcements I'll make on Sunday, and I'm not in a position. I think you'd understand. I'm not in a position to be able to announce what will be today, what will be decided and announced toward the end of October. I simply don't have enough data. I'd be speculating, and it's not safe to do that. You've got to be guided by the science of this.
I wanted to
I wish I could. I wish I could provide an absolutely definitive answer today about what was going to happen. Very, 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 very soon. But that's not the nature of this thing. And there's many wicked features to this virus. Its infectivity, the fact that it's silent in many people, very, very mild symptoms, and that's when you're most infectious in that pre-symptomatic period often. The fact that there's that 2-week lag where, decisions today, you don't see what the impact is for a couple of weeks, all of those things. And then, of course, there's the terrible tragedy of a mortality rate that far exceeds the seasonal flu.
Can I just ask about the suburban contact tracing?
Why don't we go Alex and then Samaya?
You said that all factors will be considered in the lead up to the announcement on Monday. So considering that there's been changes to the JobKeeper, job seeker, those are coming to an end. Is that going to factor in your decision making at all?
Changes to JobKeeper and JobSeeker are a matter for the Commonwealth Government. That's the first issue.
But it will impact Victorians that are effectively...
I'm not arguing against that point, Alex. It's a fair point, but it's a matter for the federal government. You need to speak to them about the arrangements they've got in place.
Impacting your
But
decision?
I'm coming to that. The second part of my answer is this is a health problem, and it needs to be dealt with on its merits, because only then can you move to economic repair.
The financial stability of Victorians is not a factor that you're considering.
I'm not saying that at all. What I'm saying to you is this is a health challenge, and until you defeat the virus, you cannot rebuild the economy.
Financial stability of Victorians play in your decision?
You cannot build the economy until you have seen off this second wave. As to the...
so you're saying it's not your problem? Is that what you're saying? It's not your problem, it's the federal
Alex, I
government.
always try and answer your questions as frankly as I can, but please, with the greatest of respect, I did not say that. That is not what I said. I didn't come anywhere near saying that.
You said it's a health problem, it's a federal
It's a
government
health problem, but if you would like to speak to someone about the rates of JobKeeper or the rates of JobSeeker, then can I respectfully suggest to you that the authors and funders of that program, which is the Commonwealth Government, would be uniquely placed to answer those questions.
And you're saying that won't be a factor in the decision when you
I'm
make
saying the rules are based on a health outcome. That's what they're based on. That is not that shouldn't be interpreted the way you've interpreted it, because I've said nothing about that. I'm talking about the health issue and the health challenge, and there can be no economic repair until we beat this virus. That's just a fact, and that is the answer to your question.
I think, Premier, with respect, I think Alex's question was more going towards, does the economic impact factor into your account, or are you only looking at the health impacts?
We know and understand that there is very significant economic damage and financial hardship and pain as a result of this global pandemic. However, if you start trying to use economics to solve a health problem, it won't work. If we could do the economic repair first and deal with the virus later, then that would be a choice we would probably make. But this is essentially, ought we be opening up faster because JobKeeper is going to be reduced? The relevant factor here is that's not unimportant. But it's not a health issue. The virus has no awareness of the level of JobKeeper. It will continue to spread. It will continue to spread, and it will continue to infect people and hold us back from opening up. The longer we fail, if we were to fail, to focus on the health issue. That's what we are focused on. But beyond that, though, there have been substantial financial supports provided to business, record levels of support. There is substantial boosts in funding for a whole range of services that are critically important at the moment, whether it be mental health support, family violence support, homelessness support, the list goes on. And we will have a budget later this year that will detail a massive program of investment and support for jobs, for livelihoods, for profitability, for confidence, for infrastructure large and small. All of those things will be a massive feature. And indeed, there's a federal budget, but very soon. And I would, from my conversations with the Prime Minister, I would anticipate that there will be very significant investment in that budget. And Victoria will benefit from that, just as Victoria will benefit from us using the state's balance sheet in our budget and the state's budget to protect household budgets.
So would you wreck or jeopardise the economy of the state to save lives?
Well, that's a choice that we have made as a National Cabinet from day one.
So the answer is yes?
Well, that's a choice that the National Cabinet has made from day one.
If you would answer that yes or no, would that be a yes or no?
Well, how I choose to answer your questions is with respect a matter for me. And the National Cabinet has made a decision that instead of allowing this virus to spread throughout the entire Australian community, much like it is in Europe, killing many tens of thousands of people, we would fix the health problem first, and then we would all, in a unified way, set about repairing the economic damage that this pandemic has done. No one's denying that. That is a feature of this virus. That's perhaps another wicked part of this virus. But you can do very little for livelihoods until you prioritise saving lives and defeating this virus. And that's the path we're on. And 6 weeks ago, there were 725 cases. 725 cases. Today, we are at a much lower number, and we can be pleased that this strategy is working. And the only steps to take are safe and steady ones. And yes, we acknowledge that there is significant economic impact, but we just can't get to repairing that. We can't repair that in a meaningful and lasting way until we have dealt with the health challenge. This is a public health emergency. It's called that for a reason, and that's what is driving all of our response. There is an economic crisis out there as well, of course, but you've got to deal with the health one first.
To clarify a statement you made earlier in this presser.
Sorry, Samaya is next, I think. Is that right? Well, you can be, anyway. Whether you are in the queue or not, you are next, Samaya.
At the start of this presser, you mentioned that Western Health and Austin Health will begin setting
Yes.
up. Can you go into a bit more detail around that? When will they be set up?
They're being set up, well, they're doing some work now. They'll be set up in earnest later this week and into early next week. Monash Health, they're in slightly different places. Western has been doing some contact tracing and some community engagement virus prevention work. Monash Health, we know in very clear details the work they've been doing, particularly in relation to the Hallam outbreak. And Austin Health, I think it's fair to say they would be just a few steps away from those two. But certainly I think by this time next week we're looking to have all three of those stood up. And then they'll kind of ramp up as well. They might start quite small, but I think Monash is going to be ahead of the others just because of the work that they've done. And then I think there'll be at least one, maybe two more. And as soon as I can confirm who the partners are with those, I'll be happy to do that.
Which suburbs will they be set up in?
So Austin Health is out in Heidelberg.
Oh, sorry, where the hospitals are.
Yeah, yep. Although that's Monash, I assume it'll operate probably a hub out of. In fact, I'm not sure, and that's a big region, so I won't try and guess it, but I'll try and come back to you.
And is this the decentralised suburban contact tracing model that you had flagged a few weeks ago?
Is this that?
Is this that?
Yes.
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 Premier, can I ask for your reaction to the decision by an Israeli court to declare that Malka Leifer can be extradited to Australia? Is that a big moment for
Yeah, it is.
her campaigners and her victims here in Melbourne that couldn't be in Israel for the decision?
Yeah. This is a very significant day for victims of child sexual abuse across our entire state, and to come as it does so close to Jewish New Year, going to say Shana Tova to Darcy Ehrlich and her sisters. They're heroes. The courage, the grace and the dignity of those Victorians is quite amazing. And whilst I'm not able to comment in much more detail about that matter, and I understand there's an appeal been lodged overnight, this is a really, really good outcome for victims of child sexual abuse. And to Darcy and her family, to her sisters and their extended family, they have our praise. We admire them. Their strength is an inspiration.
Can you at all, I know you're constrained by the legal process over there, but can you tell us about how the OPP or the Victorian system would deal with Malka Leifer's case were she to be brought back here to Australia? Would it be expedited, or would it go through the same?
Sure.
Because obviously the courts are held up at the moment.
Yeah. I can't speak to that, but I'm more than happy if there's an interest in it. We couldn't speculate about that individual case, but in terms of a process in a broader sense, I'm more than happy to try and have some information gathered up for you.
Just to the Westgate title, the reports that taxpayers will pay $750 million extra in costs for soil. Do you have any comments on that?
I think that Minister Allen, the Minister for Transport Infrastructure, is making some comments about that matter. I would just say in terms of claims, we have a fixed price contract. We expect it to be honoured. These tactics are tiresome and they will not work. They've not worked in the past.
You said as well that Victorians would not pay 1 cent extra.
Well, we have a fixed price contract. And
so are you saying the soil costs are external to the actual project costs?
No, well, I think it's important to acknowledge that some of the tactics employed by some involved in a number of major projects is not just about actual costs that have been incurred. So if there's a material change, it's about making claims that are an attempt to try it on, as it were, and that will not work.
So, but Victorians will be paying a lot more money to remove the soil.
Well, that matter isn't settled. So that matter isn't settled. But in terms of providing you with an update, Minister Allen, I'm speaking in the broader context, and I think you've seen me talk about some of these matters on a number of different projects. So I'm just repeating what I've said previously. As to the specifics of the report, its accuracy or otherwise, Minister Allen is going to either has spoken to that or will.
So you maintain that the budget will remain the same for the project as when you announced it?
In terms of advancing the interests of taxpayers and the interests of the state, I'm sending a very clear message to those who would make claims against the government and therefore against taxpayers. This is not a contract that's held with us. The contract is between Transurban and its builders. We have a fixed price contract.
You did make the threat towards Transurban when issues with this were announced last year that you would consider revisiting the concession deed. Is that still on the cards?
Well, I wouldn't quite term it that way, but what I would say is we're very clear about our position. We expect this project to be built. We expect that our contract is honoured, and we're always happy to work in good faith if there's a material change in circumstances, but the contract is not with us. The contract is in fact with Transurban.
So were any changes to the concession deed still on the table, or is that...
Everything's on the table if people don't act in good faith. And what's more, if I can go, I'll go one step further. It's not new, but I've made the point already today. When we let contracts in the future, and be clear, there's no government in this country that's got a bigger pipeline of infrastructure than this one, and we're going to add to it in record terms when the budget is delivered soon. We always look to the conduct of bidders And if bidders have decided to play games instead of build things, that's a material fact. That is a material fact, and it goes directly to whether they will win contracts in the future. That's just the way it has to be. We want people who actually build stuff, not people who think the construction company's best performances are in courtrooms. That's not how it works. That's not inconsistent with things I've said before, but for the purposes of clarity, I thought I'd make that comment again.
There have been concerns that if companies are expected to incur costs that were not in the original documentation, that you will have problems with top-tier companies going for contracts on your future major projects. Are you concerned at all that you may have Australian companies or companies that are currently active in Australia not being part of the tendering process in the future for your major projects because of that?
No, I don't think so.
Oh, I've just got one question, just to change topic. Just on the protests that we've seen unfold over the past few weeks, would you say that the response from the police has been quite militant?
No, I think police are doing everything they can to enforce the law. And if people are uncomfortable with the fact that police have to take certain steps to enforce the law, then they ought to reflect on the fact that they've made a choice to go and protest and potentially spread this virus. It's not smart, it's not lawful, and Victoria Police in very difficult circumstances are doing the best job that they can. Having said that, there was an issue that an officer has been stood down, and there's a process. I'm not reflecting on that. I'm speaking in broad terms. Don't be out protesting, no matter what you're protesting for or against. Now is not the time for that.
What about those charged with incitement, though? Do you think that's been a bit...
Well, I don't make decisions about what people get charged with, and I don't make decisions about how and when fines are issued. They're independent decisions of the executive, as they should be. I don't think we want to get into a situation where I would be involved in that. But Victoria Police are doing the very best job they can, and I understand why there's a focus on some of this. I think it's a minority of people, but I wouldn't want that focus to take away from the amazing work that the vast majority of Victorians are doing. Following the rules, driving these numbers down. That doesn't happen by accident. It happens because people have got that absolutely steely determination to beat this second wave and to do it properly in a lasting way. Let's not detract from the amazing work that many are doing by focusing on a very small number of people who are making selfish and unlawful choices.
Just to clarify, just to pick you up on something you were answering Mel with, you said that an officer had been stood down. Was that related to a COVID protest, or was that regarding the matter in Melbourne?
That's happened at the same time and received, I think, quite a bit of attention.
Yeah, but that was separate to COVID.
Where it sits in the spectrum is a matter for others. It's been very topical and very recent, and I just wanted to make the point that I was not speaking. I was not engaging in a debate or a discussion or a commentary about that matter. It's in a process, it should be. Yeah,
but to be clear, there's been no officers disciplined over actions to do with these
not that I'm aware of,
though.
But again, that's not a matter that I'd necessarily be briefed on. Victoria Police could deal with that if you felt the need to talk to them about it.
Just quickly on your omnibus bill before we go to Luke, a group of 14 QCs and retired judges has written a letter expressing concern about the fact that it would authorise people who are not police or even public servants to act as authorised officers. They've said that authorising citizens to detain their fellow citizens on the basis of a belief that the detained person is unlikely to comply with emergency directions by the authorised citizens is unprecedented, excessive and open to abuse. What do you say to that view?
Well, I wouldn't agree with the second and third descriptors they've used. But I'd certainly...
Excessive and open to abuse?
Indeed, I wouldn't agree with that, because I think you can put a process in terms of the recruitment, frameworks, oversight, all of that I think can be managed. In terms of the first point though, the notion that it's unprecedented, yes it is, because we're in a 1 in 100 year event. This is not in any way business as usual, and if you're going to have COVID safe plans enforced, if you're going to have people doing the right thing so that we jealously guard the low numbers that we are in the process of actually delivering, then you need to have a bigger enforcement team. and they'll play many different roles, but I think we've struck the right balance there. That isn't to say that everyone needs to agree with that view. People can have different views, and if people have got have the time to share those views, that's fine. That's a healthy part of our democratic system.
Have you?
And Samaya, you want to talk to Luke. Is there any more questions for me before
I
I...
was just going to check on Omnibus. So has there been any update on negotiations with upper house crossbenchers on that? Okay.
Sorry, just also, Professor Coatsworth said yesterday that there was definitely no discussion of a curfew with the AHCPP group.
Yes?
Just wondering if you can give us a reason why the curfew wasn't considered important enough.
Well, a couple of things, Alex. Firstly, there is a legal matter that's on foot at the moment, and I wouldn't want to be prejudicing the position of the state or running a commentary on that. That's just the normal approach that I really have no choice but to take. On the issue of the AHPPC provides advice as it's the Australian Health Principal Protection Committee, or I might have the P's wrong, but anyway, AHPPC. That's about providing public. Am I right, Alan?
Yeah.
Very
Health
good.
Protection Principal Committee.
Health Protection Principal Committee. It's a national committee. It's an Australia-wide committee. So on that basis, it would deal with matters that I think were not exclusively, but more often than not, they'd be issues that were relevant to the entire country. So that's my answer. We've sorted out the acronym, and it's just better to be referred to as AHPPC, I think. No more for me? Righto, Luke?
Thank you. I just wanted to ask how you feel the federal government has handled the aged care sector in Victoria.
Look, I think VARC's worked incredibly well together, led by Joe Buffoni. I think it's brought all the resources in that we need, in a sense, to support the aged care sector across the state, whether it be the Defence Force, AUSMAT, Department of Health and Human Services. They're all in there together, and there's a real focus in terms of dealing with outbreaks, but also I guess a preventative role more than anything else, whether it be, I think from memory, Defence Department's had about 230 visits, there's a couple of hundred visits from work cover. There has been work, Monash Health has been doing an enormous amount of work in prevention, infection prevention training, so it very much brings a real focus to providing confidence and protection in aged care. So look, I'm very positive about it. I think it's worked incredibly well.
How do you rate the performance of the aged care minister, who obviously in Parliament and also in the Senate Estimates Committee couldn't recall the number of people who had died in aged care facilities here in Victoria? How would you rate his performance as a federal aged care?
Look, I've been very, I've worked well with the aged care minister. So when we've asked for assistance and asked to work together, the answer's been yes. So I can only reflect on what's occurred on the ground here, and it's been positive. Absolutely positive. So as to parliamentary performances, I'd leave that to others to make those assessments. But in terms of the work we've done, I've been in engagement with Richard on an ongoing basis, and when we have issues in terms of how we want to approach something, we work them through. So look, I couldn't be more positive about my engagement with the federal minister, my engagement with Joe Buffoni and the team. I'm very, I think it's gone very well.
Government is obviously responsible for the private aged care sector here in Victoria.
Yep.
We've had experiences with Newmarch in Sydney, and then we also have international experience that shows how deadly the virus is when it gets into aged care. Do you think the feds were too slow to act in preparing Victoria's aged care facilities?
Look, I think, this has been, I guess we only go through outbreaks like this once every 100 years. So straight after Newmarch, we changed our settings so that every incident of COVID positive turns into an outbreak. So in other words, then we bring in the resources and so forth to assist in terms of disaster management, but then also to deal with the ongoing infection prevention, dealing with staff and all those things. So, I think it's pretty good to be, it's gone as well as can be expected, in circumstances like this. But, we changed our settings, we asked for work with the Federal Commonwealth, and we're doing that work together.
I also wanted to ask ask you a question as an MP as opposed to a minister.
Yep.
We know that this virus doesn't discriminate, but it obviously affects some of the most vulnerable in society disproportionately, including those who are vulnerable in an economic sense.
Yep.
I guess how has coronavirus impacted on your local constituency, and what kind of cracks has it exposed and opened out in the southeast?
Look, I think it impacts across the board, but we've got a state, unlike many other states, you can move from the southeast to the west in the space of an hour in Victoria. You can't do that in, say, New South Wales. So, in terms of the way it affects our community, you can get around a lot more easily in Victoria than you can in other states. And of course, when you're working in a high-risk environment, and you're that the potential to spread the virus is high. So, in other words, over the weekend, I did an enormous amount of work with community leaders locally to ensure we got the message across, to ensure that we encourage further testing, to ensure that older members of the community very much were putting pressure on younger members of the community to work together to actually defeat this virus. So, in many ways, it's very much been a localised response down in my way in the city of Casey to the outbreaks, and it's very much been the community leaders that we've worked with to actually get that messaging across. One of my community leaders took 70 packs yesterday of face masks and sanitizer and the like, and that has worked incredibly well to get it to where it needs to immediately. So, look, I think it's, for me, it's a matter of trying to provide as much support, as much care, and a much, protection for my community locally. And I very much thank the community leaders. And look, for that matter, I thank all those people in the workforce, whether it be aged care and so forth, the marvellous work they do in incredibly difficult circumstances at the moment.
And do you think you're able to reach most of those communities? Because at the start,
Yes, those communities are very connected. They're very much led by their community leaders. So, I think I had one meeting with Ros Spence, which had, 30 to 40 community members in there. One of the community members I work's a qualified gynaecologist. Isn't practising as a gynaecologist, even though she could be actually a gynaecologist in Melbourne and be earning a reasonable income. She has made a decision that she needs to be a community leader first and foremost. She won't act as a doctor. She is there leading her community. She comes from a long line of doctors. But the most important thing is she's there leading, and the community has confidence in what she says because of her experience in the past. They're the community leaders we're working with to really ensure that the people, when the messaging is coming across, it's coming from members they very much trust, and that's the work we're doing.
On the aged care facilities, are we able to get a list of the 50 that are getting funding, please?
Yes, I think there we list. I think
it's not been sent out. So
okay, I'll get that. Yep, yep, happily.
Any other issues? If not, thank you.
Thank you.
Thanks, Dan.